The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far and looking forward for a nice and relaxing weekend. This program is broadcasting live from the studios of Inspire FM today on 23rd of January 2020. Wow, the January is almost over. It seems like yesterday when we are celebrating New Year. Well, this program is casting all our positive vibes to all our lovely people in Luton and the surrounding areas of Luton, like Dunstable, Harpenden and Bedford, and our positive airways reaching all our listeners across the patch through our Inspire FM Facebook page. You can view us through our Inspire FM Facebook page. You can listen us through our Inspire FM app and website, and various other podcasts. Hopefully you are listening to the show live, but if you are not and you're listening or viewing, see, I cannot even pronounce my own words. If you're listening or viewing this show on any other day, like Sunday or Thursday, that means it's repeat. Hey ho, today is 23rd of January 2020 and today is the live show. As we know, we cover different health-related topic every single week, and today's topic is something which is in the line. As you all remember, we were in the beginning of the or end of the summer, beginning of the autumn, we were covering a very unique topic, which is flu uptake in schools, and we have emphasized on how we have mobilized a very small pilot in last 2 years and work our way gradually where we can provide flu vaccinations to our kids which do not have any pork gelatin. So that has taken quite a bit, but then that has have a good impact, and we have a guest who will explain about this. But we need to emphasize on flu uptake as well. So topic for today is flu uptake in Luton. Yes, you have heard me correctly. We are talking about flu uptake in Luton. And as always, I'm not the one who will be talking on this topic. I have a lovely guest with myself in the room, and it's really nice to see a room full of guests, because I'm nothing all by myself. I need an expert advisors or expert people who can inform me about the topic. And our listeners especially, because they are the ones who need all the information along myself. So without further ado, let me introduce our guest for tonight. The guest, we have very special guest tonight. So let's introduce our guest from right to left. On my right, the very first guest I have is Becky Twist. And she's the Clinical Delivery Manager from Essex Partnership University Trust. Good evening, Becky.
Hello, Fahad.
How are you?
I'm good, thank you.
And next to Becky is Barbara Hamill. Now she's the Immunisation Manager from NHS England, and now and also she was mentioning about the Public Health England, East of England, and I completely forgot. So I have to ask her if you can explain, if you can introduce yourself with the full name and the title, please.
Hello, good evening. My name's Barbara Hamill. I'm the Immunisation Manager for NHS England, the East of England, and Luton is in my patch.
Okay, good. And she's the lady who has worked a lot and helping mobilize this whole childhood flu uptake, a special pilot program for people who do not want means alternative to pork gelatin one. And next to her is a very first time a guest for the show, but definitely not the last. and I like to introduce Cath Fenton, and she's the consultant lead screening and immunization for Public Health England. Good evening, Cath.
Hello, thank you very much for having me.
How are you today?
I'm very well, thanks. How are you?
I think so. You very bit. Yeah, you need to be. Oh. Yeah, please.
Hello?
Yes, I can hear you now.
Okay, cool.
Yeah. So yeah, for some reason I cannot hear you in my headphones. So how are you today?
I'm very well, thanks. How are you?
Alhamdulillah, alhamdulillah. So tell us about yourself.
I'm a consultant in public health. My background's been in children's public health and immunisations, and I work across the East of England.
Okay. I normally have a full introduction about what is your interest and how you came into the whole thing, but because we have a very long agenda, so I just like all my guests to give a quick introduction, just like yourself. So Barbara, can I have you as well?
Yes, I work for Public Health England, NHS England, and my role is I'm the manager of immunisation, so I'm very... one of my key roles is to try and promote good uptake amongst everybody who needs to have a vaccination, because I want to keep as much of the population as healthy as possible, and vaccines are a very good option to prevent infectious diseases.
Mm-hmm. Thank you. And Becky?
Hello. So I'm the Clinical Delivery Manager with the EPUT Immunisation team, and we do all the vaccinations for all the school-aged children in Bedford, Luton and Milton Keynes. So, yes, I'm a paediatric nurse. I worked with children for a very long time.
Mm-hmm. So it is really nice to have all of you and the big brass with me, and I'm really delighted to be part of this team. So let's start with you, Cath. Tell us, why do we still talking about flu?
So flu is usually a seasonal disease, and we usually get the peak numbers around December, January time, but it can go on, and we are still seeing quite a lot of flu in the community. So there are people still being ill, still going to their doctors. Unfortunately, some people who are quite seriously ill going into hospital. So because flu is still circulating, we just wanted to promote the fact that the flu vaccine is still available, and if people haven't had a vaccine, now would be a good time to have it.
Right, okay. So I thought flu is over, but it seems like not, because I just literally heard an outbreak of some flu kind of thing in China as well. So
there's all sorts going on over there, but because flu does happen all the time all over the world, we will still see cases in returning travellers, for example. So Australia will have their flu season a different time to ours. So it's always important to make sure that if you are eligible for flu, that you get your flu vaccine.
Mm-hmm. So that means the normal time frame. What is the basic time frame of getting flu vaccinations?
Well, we like to encourage people to get into their GP service or their pharmacy as soon as possible, so September, October time, whenever the vaccine becomes available, because that way they are protected before flu starts circulating. But if you haven't got round to having it yet, because we are still seeing cases of flu, it would be a good opportunity to go and get vaccinated.
Okay, so in terms of people still thinks that the flu is bad cold or cough, and you can recover quickly. What's your thought on that?
I think unfortunately people do tend to blur colds, viruses, flu all together. So people say they might have had a touch of flu, for example. If you've had flu, you know you've had flu. It is very serious. Even in healthy people, you take quite a while to recover. So I'm one of those annoyingly healthy people that is never ill. And I had flu about 10 years ago and could not get out of bed for about a week. So that meant that I was completely reliant on family and friends to look after my children, to take them to school, to do my food shopping, to cook for me, to clean. I really couldn't do anything for a week. And after that, I was still coughing for quite a long time and took a long time to get my energy back. So although there are similarities in some of the symptoms, so you might have a runny nose and a cough, the severity of it is a lot more. You'll have aches and pains and a sense of complete fatigue where you can't do anything. So it is much more serious than a cold.
Barbara, is it easy to catch flu?
It is easy to catch flu. You can be in a room with somebody and catch flu. It's very infectious. And when an infected person coughs or sneezes, they spread the flu virus, which is in tiny droplets of saliva, over a wide area. And these droplets can then be breathed in by other people, or they can be picked up by touching surfaces where the droplets have landed. What you can do to try and keep as healthy as possible is to try and prevent the spread of the virus, and this is by covering your mouth and nose when you cough or sneeze, and you wash your hands frequently. And we all know the phrase, and I always get it wrong, but it's kill it, bin it.
Kill it, catch it, bin it.
Kill it, catch it,
Catch it, bin it, kill it.
Catch it, bin it, kill it. Still haven't got that right, but that's really important.
Yes, and I remember in one of our last shows, one of the listeners did message me on Facebook. Unfortunately, my Facebook is not on, so I cannot see it. But yeah, it was in the same line, which is catch it, bin it, kill it, or kill it, bin it. One of those things. Anyhow, while we are talking about listeners, so listeners, let me call our listeners as well. So listeners, if you have any questions or queries regarding our show tonight, please get in touch with us by sending us a text message. We're not opening our phone lines today because we have quite a few things to discuss. So if you'd like to send us your thoughts, or if you'd like to part of the show, or if you have been infected with flu, or somebody else have flu vaccines done in your family and safeguarded from flu throughout this year, please, I'd definitely like to hear from you. Get in touch with us by sending a text message on 07779 481822. You can send WhatsApp as well on the same number, which is 07779 481822. We're not taking phone calls today, but definitely your questions or your thoughts will be most welcome. Becky, I know as you worked alongside with kiddies all the time, school's been known to have a very area where kiddies normally get more sick, especially if they have cold and flu. Is it true?
So primary schools definitely have a lot of viruses going around, if that's what you're asking about. Yeah, and mainly because they're not very good at sneezing and doing the catch it, bin it, kill it thing. So sneezing and coughing into hands and then going and touching each other, and hugs and touching taps and all sorts without washing their hands. So they're very good at spreading. So that's why we go out to all the primary schools and vaccinate reception up to year 6, because they like to spread their love and viruses
and germs.
The germs.
So as I was asking earlier, is it easy to catch? But become infected with flu virus, what do you reckon? Is it good or bad?
Definitely not good.
No, I still remember how ill I felt, and that was about 10 years ago.
Ooh, okay. Share that experience with us, please.
I started off with what I thought was a cold, and it just got worse and worse and worse. And then I was in bed. I couldn't move. I couldn't do anything. And I just felt so ill. The very bones of me ached. I had no energy. I really couldn't move. So my poor children, who were quite small at the time, got no love, no hugs, no food, unless we had friends coming in that would bring them food. I really could not do anything. So yeah, it is very, very nasty. And since then, I've had the flu jab every single year because I'm not running the risk of getting ill again.
Wow, that's really nice. So, one of the very awkward things, as you have already gone through a traumatized event yourself, experience yourself, one of the people normally think that if they have flu vaccine, they will get flu. One of the very big misconceptions. Is it true?
No. The flu vaccine cannot give you flu. The thing that we do say is get your flu vaccine as soon as you can, as soon as it becomes available, because it does take a couple of weeks for it to start working. So we don't want people who are already coming down with an illness, then going and getting a flu jab and then blaming the flu jab on that illness that they were already becoming ill with. So if people get vaccinated September, October time, and that's before flu starts circulating, their body has time to make the protection that they need to fight off the illness. And there's not that also confusion between an illness that's already going round and their vaccination. Having said that, it's still worth getting the vaccine now, even though it will take a little while to build that protection, because we will still have cases going on into March and April.
Okay. In terms of one of the things which I do want to know is, once I have a flu vaccines, will I be protected? And how long the protection will be, and how many years?
So the flu vaccine changes every single year, and that's because the flu virus is very clever and it changes every year, and different viruses circulate across the globe. So there's a whole tracking system to work out what's happening in one part of the world that might then affect this country. So the vaccine is made of different ingredients every single year to make sure it gives you the best protection. And the good thing that happened this year is that they got it right. So they did their work properly, and they did their modelling right, and they picked the right viruses to go in the vaccine. So there's a very, very good match between what's in the vaccine and what's circulating. So it will give you very good protection with what we're seeing in the community at the moment.
Okay. Barbara, one of the things which I do like to ask is that one of the other very awkward misconception is that if I have a flu vaccine, I will never have flu. So, especially even if I have, it will not give you 100% coverage, is it? Am I right? Or will it give you 100% coverage?
No vaccine gives you a total 100% vaccine protection. But the flu vaccine gives you very good protection. I mean, are we looking at about, for older, over 65%? We've got the over 65s. We're currently about a 62% good efficacy rate, which means it's, having a good impact in protecting. For children with a nasal spray, it's got a very good protection rate. And also, if you have the inactivated for, at risk, which is an injection, has also got reasonable protection. Certainly enough to support your immune system in protecting yourself against flu.
And as you just...
Particularly if you've got a complication, if you've got, Cath was... As she said, she was healthy when she got flu, so she's a healthy person. She's not had, she's not got any other underlying conditions. But if you have got underlying conditions, it's very important that you have the flu vaccine. And I don't know whether, Cath, you can add anything to that about the protection rate.
No, only that it's the best that we've got, really, and it's worth getting it done. And even in years where there hasn't been a particularly good match, it does provide you with some protection in that you might get flu, but it won't be as bad as it would have been if you didn't have anything in your system to help. So I would say this year the scientists have done it well, so it's a good match and well worth doing.
Okay. In terms of, as just Cath mentioned, about people who are not well, so people who are suffering from some kind of a condition in their life, either they have long-term condition diseases, or if they have immunosuppressants, people who get infections really quickly, or even people who are above the age of 65. So why is it important for those people to get vaccinated?
So for the over 65s, it's because your immune system doesn't work quite so well as you get older. So the flu vaccine helps protect you and helps your system work a bit better. And then there are a range of conditions which put you at more risk from flu. So for example, with something like severe asthma, your lungs are always already a bit compromised. So you really don't want to be getting a respiratory infection because your lungs will cope much worse than the average person. But on top of that, it also causes complications to how you manage your underlying condition. So for an asthmatic, they would have to change how many doses of their inhaler they were doing, for example. So it puts someone who might be with quite a well-controlled disease, it puts all sorts of things, strains on their systems. So there's a whole range of people that would benefit. So those, as you've mentioned, with heart problems or breathing problems, kidney disease, lower immunity, liver disease, diabetes, neurological conditions, those that are severely overweight, and of course pregnant women as well will also benefit from a vaccine, and that not just protects them but protects their unborn baby.
So as you just mentioned about pregnant women, how important it is for pregnant women, and when do they need to have the vaccine? Barbara?
Pregnant women, they can have the vaccine any time of the as soon as they get pregnant would be ideal, because they're not only protecting the baby, but not only protecting the woman, but also protecting the baby. It can be, as I said, given safely at any stage of the pregnancy, and as far as the woman's concerned, it reduces the risk of serious complications such as pneumonia, and particularly this can happen in the later stages of pregnancy. But also it helps to reduce the risk of miscarriage or having a baby born too soon, prematurely, or with a low birth weight. But also, which I always like to sort of emphasise with a woman who's pregnant, this is the first thing she can do for her unborn baby to make sure that when the baby's born, it's as safe as possible against this infectious disease, because unfortunately the vaccine is not available for a baby under 6 months. So the baby has to be 6 months before they can have the vaccine. So by her protecting herself, she's giving the antibodies then to the baby, and the baby is then being protected for that very sort of vulnerable stage. And then particularly if you then have a baby who's born and who has complications, could have respiratory complications, if they're born early and they've got lung problems, if they're at least protected against flu, they haven't got that to have to fight and contend with. So very crucial for a pregnant woman to have the flu vaccine. I cannot emphasise that enough. And my problem in Luton is we've got a low uptake for pregnant women.
Oh, okay.
Yeah.
Why is that?
I don't know. Because it's we've got a dual access. They can go to their GP. They can go to the Luton and Dunstable Hospital. They're offering it, maternity services, and also pharmacists as well. And currently, I can't. I'll just tell you what the uptake is. You just.
I have to get back to you on that one.
No problem.
Have I not? I do apologise.
There we go.
I thought
a whole list of pregnant uptake there.
Right. So the uptake for pregnant women, the total, up until the second week in January, is 30.5%.
30.5%?
Yes, and what we would like is at least 55%.
Right, okay.
So
Ideally, we'd like them all
100%.
vaccinated.
Yeah. I mean yes, absolutely. That's a target we'd be given, but obviously we want them all vaccinated. So, as I can't emphasise enough, we need to pregnant women in Luton need to come forward.
And they can get vaccines from GP surgery, hospital, as well as pharmacies as well.
Yeah.
Okay, so all they have to do is just go and identify themselves that they're pregnant and they need vaccine. They will get vaccine.
Yeah.
Without any charges.
And also, just for the pregnant women to remember, the flu vaccination, it's a flu vaccination per pregnancy.
Mm-hmm.
So it doesn't mean once you've had it.
That's it.
That's it. If you become pregnant again, then you need to have another flu vaccine.
Yeah, definitely.
Yeah.
And on that note, I must say, wow, the time has passed so quickly. We are already approaching mid of the show and fastly approaching the break. When we come back from the break, we will talk more about flu vaccine, and we will ask Becky about the campaign regarding the children's schools flu uptake and how schools are doing in total, because we have done a very good long project and we want to know how good the schools have responded this whole year about this one. So this and many more, and we will definitely ask about why the adult people who need vaccines, why they are very, very important as well. Stay tuned, we will be right back after these very short messages.
You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. I welcome you back to the Health and Fitness Show. I'm Fahad Matin, your host for today's evening and today's show, and we are talking about flu uptake in Luton. Obviously, we are talking about flu topic in general as well, and we are highlighting all the positives and all the positives about flu and negatives in terms of if you do not take flu vaccines, what negatives will come to you. With our lovely guest in the studios, and they are, I have from my right to left, I have Becky from East of Essex Partnership University Foundation Trust. I have Barbara Hamill from NHS England, and I have Cath Fenton from Public Health England. This program is broadcasting live from the studios of Inspire FM today on 23rd of January 2020, and definitely this program is and positive and casting its positive vibes to all our lovely people in Luton and surrounding areas of Luton, like Dunstable, Harpeth and Bedford and all the surrounding areas. So I will welcome back all my guests, and I will say, welcome back, guys. Good evening.
Welcome back.
Hello. Thank you.
So just for our listeners who have just joined us now, a quick intro from you guys. So instead of from my right to left, I'll go from my left to right. So let's start with you, Becky. With you, Cath.
Okay, thanks. Cath Fenton, I'm a consultant in public health, and I'm the immunisation lead for the East of England, covering Luton.
Okay.
And I'm Barbara Hamill, Immunisation Manager for the East of England, and I also cover Luton.
And I'm Becky. I'm the Clinical Delivery Manager for the School Immunisation Team, and we do all of the schools in Luton, vaccinating at them.
Perfect. The team which serve for the Luton and look after the population of Luton. I love that. So before we went on break, we have talked about flu in terms of why we need to take flu. What are the time frames of the flu? Who's important? Who definitely need to take flu vaccinations, how it protects the infections, and if you are taking flu vaccine for 1 year, it doesn't mean that it will cover you for life. You have to take it every single year, right?
Correct. Yeah.
Indeed. Okay, cool. I'm remembering all the stuff, which is good. So in terms of when we talk about the children's, do children need to be flu vaccinated, and or their immunization system, their immune system will be tough enough to protect them?
So if a child's over 6 months and they've got a health condition that puts them at risk, they do need to have a vaccination, yes. Unfortunately, babies underneath 6 months, the flu vaccine doesn't work very well in them, so it's not recommended, which is why we ask pregnant women to get vaccinated to protect themselves and their babies. We also run a Healthy Child School programme, and this vaccinates all children in schools from reception to year 6. And that goes back to what Becky said earlier about how children love to share their love but also share their germs. So by vaccinating all those children, we try and stop them spreading the germs around themselves and to their families, so it protects them and the community around them.
So does a child who let's say have a bad asthma need a flu vaccine?
Yes.
Why?
Yes. Because their asthma could get worse if they get flu, but also if they get flu and they've got asthma, it will affect them much more severely than a healthy person, because their lungs are already compromised slightly. So yes, there's a list of people that will benefit from a flu vaccine, and for children that's probably most likely to be if they've got asthma or diabetes or they've got an immune issue.
Okay. I do want to hear from our listeners as well. Have they had flu in their life, or if anybody in or one of their loved ones have suffered from flu, or if they have any flu vaccines. So listeners, if you had any of those things, if you had flu vaccine, or if you had flu in your life, or if you had flu vaccine and did not have flu, I definitely want to hear your thoughts. We are not taking phone calls, so hence just send me your thoughts via text message or WhatsApp on 07779 481822. I repeat, you can send your comments on or thoughts on 07779 481822. You can send it by Facebook Messenger as well. So in terms of when we talk about kiddies and kiddies love, I know Becky, you have run a successful flu vaccine program for kiddies in the school, especially
Yes.
for those 10 piloted schools where we have run the special clinics. In terms of why don't you, instead of me talking about it, why don't I let you
So the vaccine that's recommended for children, because it works the best, is a nasal spray, and the nasal spray does have pork gelatin in. And 2 years ago we did a study over some of the schools where the uptake wasn't as great in comparison to some of the other areas more locally. And this flu year just gone, the 10 schools, so there were 6 mainstream schools and 4 faith schools, we went and we offered 2 vaccinations. We offered the one which had pork gelatin in, the nasal spray, and we offered an injection as well. And we did it because we wanted to see what the difference would be, whether the uptake would be improved by offering the vaccine that parents have asked us to offer, the one without the pork gelatin. And yes, there has been a reasonable response rate. Around 49% of parents in those 10 schools came back to us with both yes and no consent forms. So about almost half, which was really good. And that was a similar figure across the other schools in Luton as well. So we would have liked to see more forms coming back into school, but 50% is definitely better than it has been in previous years.
what was the previous years, if I don't mind my asking?
Oh, now you're asking. It was more in the 20s, late 20s, early 30s.
Yeah, it was. I think the highest was about 31%.
Yeah.
I mean, having said that, Becky and I were discussing this because a lot of work went into this study, and we really spoke to parents and got their views and asked them if we did present them with an alternative alternative to the non-porcine vaccine, would they take it up? And parents all said yes, they were really keen in having this alternative vaccine, which was only for the 10 schools. But we have been disappointed with the uptake because we gave them that choice and they chose to have another vaccine. We thought the uptake would be much, much better because it wasn't done without consulting with parents.
Sorry, I just literally have a question in front of me from one of us listeners, and it's a really important question. So that's one of the reason I've stopped you. And thank you so much for sending us this question, listener. The question says, Are the flu vaccine religiously okay for the people of Islamic faith?
If we talk about, we'll talk about the children's, because it's the nasal flu, which is it isn't an injection, it's a squirt up the nose, which is recommended as the clinically best option for children. That does contain the porcine gelatin. Any of the injectable vaccine does not. That doesn't have any porcine. And that's why, although it's for children not as good as the nasal, slightly under the protection that a nasal flu gives, it's still good enough to give. And that's why, because there was such a low uptake, and we knew parents had this problem with the porcine gelatin, we then offered this alternative. And we're the only area in the whole of the country to give parents this option. And that's why we thought they would really take it up.
Because the follow-up of that question says, I was not offered a vaccine for my children who would have required a non-gelatin based vaccine. So I do want to come back to you, Becky, because you have done this, because those 10 schools, or can you give us, I know I'm putting you again on the spotlight.
No, it's fine.
Do you know the names of those schools? And brother, is your child go to any one of those 10 schools?
Oh, here
Becky.
we go. Right. So the 10 schools that we've included in the study are Maidenhall. It's called Maidenhall, yeah. Maidenhall, Denbigh, Downside, Icknield, Beechwood. Oh, I always forget the sixth one. I've said Denbigh, Downside, Icknield. It will come to me. And then we've got the faith schools, Merrier, Rabia, Oakwood and Olive Tree. I'd just have to think of the other mainstream school.
Sorry, I'm literally searching my
No, it's
one
okay.
as
Lee Grave.
That's right.
Lee Grave Primary. Sorry, Lee Grave Primary.
The person says my children attend Somerset Summaries Infant and Junior School.
Yes, so the schools that we chose, when we looked back right at the beginning of doing the study, had the lowest uptake. Some of them had about 10% of the school, but nothing really went above 15%. So they're the schools that we chose. We would have loved to pick every single school in Luton, but it just would have not been feasible to do every single school. With the schools that didn't get picked, no, their uptake wasn't fantastic, but it was better than these ones. And so having their peers in the school being vaccinated was offering some protection, but we had to start somewhere. So this is where we're starting with these 10 schools, and then hopefully, who knows where it will lead us.
Because I think, just taking it back, last year we only offered it to one school. So it's a matter of growing it. But we need parents to take the alternative vaccine up to give a really sound, robust case that they do want another alternative.
Exactly. So, sorry, just literally give the names of the school again, because I have it in front of me. So it was Denbigh, Beechwood, Maidenhall, Icknield, Lee Grave and Downside.
Yes.
Okay. I have another comment from one of the other listeners saying, great show, please do not be disheartened with the results of the study. I will take the parents 1 to 2 year old of forward to separate about the great alternative. Many parents are still confused. Parents get lost of consent forms every week, so often get missed.
No, absolutely, they do. There's lots and lots of paperwork that comes home from school. What we do try and offer is a evenings or afternoons or morning sessions with the parents during the school day, so that we can talk to them, and we didn't do as many this year through discussions with the school because the schools wanted to do a lot themselves, but next year I think it does show that it does work if we are in the school just having those conversations with the parents, and they can come and talk to us.
So if I say it a bit early, and hopefully it will be not too early, will that program be rolled out to all the schools in Luton next year? I'm looking at you because you're the public health person.
I am the public health person. So I have a tricky job of trying to convince the national immunisation team that this is a really good thing to do. And they have just been back in touch with me to see how this year went. So as soon as we've got it written up, we will be sharing that, because we would really like it to be available to everyone in the country. Because there's a range of people who would rather have a product that doesn't have porcine gelatine in, whether that's from a religious or cultural reason, or because they're vegan or vegetarian, for example. So there are lots of people that it would benefit. We just need to be able to put a strong case forward that this is not people that don't want a flu vaccine, it's people that don't want a flu vaccine with porcine gelatine in it. So that's why it's really important that people do take up the offer if they can. So trying to improve the consent process is part of that.
Yes.
And parents out there who have children in those schools, you are setting the example. So that's why we need you to come forward and agree to have your child vaccinated with the alternative, because you're, as I said, you're setting the precedents for how we move it forward.
No, I absolutely agree. And being a parent myself, I definitely want all my kids are the very first one, because as you know, Becky knows very well, 3 years ago when she mentioned this in our school, and I was the one who, among all the parents, who stand up and said that why can't our kids have a porcine free gelatin free vaccines, and thank you for pushing this through, and I absolutely agree with the brother who replied back and says, but shouldn't the vaccine have been offered to all the schools regardless of the uptake, as the schools will have children who have protected characteristics. And I absolutely understand brother's point, but then at the same time we all need to work together, and hopefully our case studies will make necessary impact to the authorities above, higher above, and hopefully I'm very hopeful and
I think
praying.
we should be optimistic.
I'm very hopeful and praying. See, all my fingers are crossed as well.
And Fahad, maybe you can talk about, you came to the national conference, didn't you?
Indeed. And the amount of people, when we mention about the results, and the very first study was done for Maidenhall, because I'm a parent from the Maidenhall, and a parent governor as well. So from that school, I must say the uptake was around 20% before the vaccine, and after the flu injection vaccines, it bumped to 60%.
I think 63%.
Yeah, 63%.
Yeah.
So that has literally said wow, and that's one of the reasons it has now rolled out to 10 schools in Luton, including faith schools. Faith schools used to have 0. Now they have some numbers as well.
They have a few, yes.
So they are somewhere between 10, 15, 20 numbers. So, brother, and I'm approaching to this to all our listeners who are listening me at this time. Please do involve your fellow, your brothers and sisters who have kids going to the school, or who have elderly parents who require vaccines, or any of the sisters who are pregnant currently. Please do get the flu vaccines done, because the only thing which has porcine gelatin is the kiddies nasal screw vaccinations. Rest of the vaccines do not have any problem whatsoever, and they're safe to have. Am I right, Barbara?
Absolutely. It's only the nasal flu that has the porcine gelatin.
And
all the other flu vaccines, there is none in there. So,
And I'm saying it from the personal perspective as well. I'm a presenter, I know, and I should not be allowed to put my personal view as well. But then when it comes to greater good, it is, I think so, personally correct to put your personal views as well. What do you reckon, Cath? And what's your take on that?
Sorry, what's my take on?
In terms of flu vaccines for all?
Yeah, I mean, we should encourage. I believe there's still vaccine available through the school service.
Yeah.
So if those schools where it was offered the choice, people are still thinking, yes, I would like to take up that offer, they can contact the immunisation service to receive that. I think the other thing to remember that is, if you have a child who is at risk, you can request an alternative vaccine from your GP. For those children, there is an alternative available.
So if your child have asthma or any other conditions, they can get the vaccines through injection.
Through their GP. Yeah.
Okay, cool. Sorry, I have to come back to you, Becky, on that. In terms of the parents who have refused, what are the comments they have put through? So
we only had a very small amount of parents that came back with a no on their consent form, about 9% overall in those 10 schools. But the main reasons that came back were that their child was healthy, they had a good diet, they don't need a flu vaccination because they don't believe in vaccines, those sort of comments. And we can have a really, really healthy diet, and as Cath said, you could be very, very healthy, but you can really get the flu. And children and young people are one of those groups that actually flu can be really, really horrible for, and they can become very poorly and end up in hospital.
From a parent's perspective, being a parent, my son before this program, and I'm not saying it to promote this program, I'm saying it from the parent's perspective. My child was on his first year he got sick, and the second year he got sick. So that's one of the reasons I said I want my child, remember at that time I said I want my child to have that flu vaccine, but unfortunately due to this particular reason I'm not giving my child and making him deprived from it. So, and thank you for putting that through. And since last 2 years he's having vaccine and he's not getting flu whatsoever.
Brilliant.
So
that's good to know.
but this is something from a parent's perspective, because I know when he gets sick he is really, really sick. And I know it because I've been through that journey, and I know other parents have gone through that journey as well. And if that is the case, please, I will encourage you. Can they still get flu vaccines?
They can still get the flu vaccination.
So what do they need to do?
They need to ask for our phone number from your school, or whether you could put our office phone number on your webpage.
Yeah.
We're not going back out to the schools to do the flu vaccinations, because we're onto our secondary schools now, and we're out seeing all of those older children for something else. But we've got clinics in Luton that you can come along to, and yes, we're going to keep going with the flu vaccine up until as far as we can do, which is probably about March time, and just get as many people vaccinated as possible.
Okay, so if any of the parents who are not in that school but wanted to get their kids vaccinated, can they still contact you?
They can still contact us, but if you're not in those 10 schools, the only option is
the nasal one.
Is the nasal spray.
Okay.
At the moment. Yes. And we'll be optimistic for the next season.
Okay. This year.
Unless you've got a child who's at risk. And then
they can have.
Okay, and what's the number to call?
It's a Bedford number, 01234 310 408.
Okay.
It is very busy, so please keep trying. But I can also pass you on our email address as well if parents want to.
I'll put it on our post as well, and I'll try to put it on the website as well. I have another question popped on the screen. Says, how common is flu in children? Oh, it's open to all three of you.
You go.
I don't have numbers because to measure how common it is depends on whether a child is taken to their GP practice, for example, or they get hospitalised. What I can tell you is that there have been deaths in children from flu in this country over this winter. And
this winter.
And that is dreadful because it is preventable. So yes, in this country, in a fairly well-to-do, area, there have been children that have been so ill that they have died from flu, which is tragic.
Indeed.
But I don't have off the top of my head how many people go to their GP with flu-like symptoms or how many people are hospitalised.
And quickly, is vaccine safe, and are there any side effects?
The vaccines are safe. They're very well tested. In terms of side effects, the nasal immunisation, because it is sprayed up your nose, you might get a stuffy nose. You might not feel particularly well straight afterwards, but it's very, very short-lived. With the injectable vaccine, you might get a sore arm. So some people find it difficult to sleep that night because they have to sleep on one side rather than the one that's been injected. But by the next day, they're fine. Sometimes people get a bit of a headache. They might feel a little bit achy, but very, very minor side effects.
And maybe some light temperature so next day.
Yes.
Okay, cool. As we are about to approach end of the show, I like your comments. So if you all give quick 30-second quick messages, because we do not have more than a minute. Please, let's start with you, Cath.
Okay. I would say prevention is better than cure. So get your vaccine and stay safe.
Barbara.
Remember that you need it every year.
Okay, cool.
I'll just say I'll encourage anybody that's not had their vaccine to come and for their children and phone up and get them booked into our clinics.
Indeed. And I must say it is really honoured. It is a really big honour for me that you guys came here and spread this knowledge, because it's not easy, especially in this day and age, to have the kids vaccinated or provide these vaccines, especially for us. So firstly, thank you so much for providing this service. The flu vaccines for kiddies, the injectable ones without pork gelatin, and I'm definitely hoping and praying that it will roll out to next year as well. But in any cases, thank you so much for coming in.
And thank you for all your support.
And thank you very much for your support, because Fahad, you've been a real... You've been there and supported in every way possible to, get as many children vaccinated. And coming to the immunisation conference, the national conference, and helping to present was absolutely super.
Thank you so much. Thank you so much, and thank you so much for coming to the show.
Thank you.
That's all for our show tonight. Please stay tuned. Next week we will be talking about general prevention and why GP surgeries. You need to go to GP surgeons, and what can you be. You can safeguard yourself without going there. So stay tuned. We will be back next week, inshallah. Till next time. I'm Assalamu alaikum. Assalamu alaikum.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at InspireFM Luton.